Entering into the health administration field, while rewarding, can also be challenging at times. Some obstacles are more demanding than others. One of the most important to address is how to approach cultural diversity with the utmost respect, integrity, and professionalism. In the following scenes, we will observe interactions between practitioners and their patients, which present some cultural barriers and misinformation to gain a better understanding of how to approach situations like these.
Hi, Ms. McGinty. I'm Dr. Najjar. How are you today?
I'm okay.
All right. So what are we here for?
Well, I've been having some back pain, some knee pain. My back's been killing me. My kids are out really busy. I had to take the bus here today, and that kind of really hurt my knees. Actually, I fell off the bus while I was coming.
That's too bad.
Yeah, so it's just been a lot of problems. My arthritis. It's just been a lot lately.
I'm sorry, what was the last thing you said?
I've been having a lot of problems lately.
And when did that start?
We talked about it the last time I came to see you.
Okay. Yeah, it doesn't look like they have that on here. When was the last time you were here?
2 months ago.
2 months ago? Okay, well, you'll be fine. We're just going to hand you some prescription painkillers and that should take care of it.
But the last time I was here, you just gave me prescription painkillers and nothing worked.
Did you take them?
Yes.
Are you sure?
Yes.
All right.
I take every one of my pills every single day. I think we need more than just painkillers.
Are you sure you didn't forget to take your pills?
Yes. Yes, I'm very sure.
All right, well, I don't see anything else in your chart. Your arthritis, knee pain, back pain, prescription painkillers should do the trick. You'll be fine. Have a good one.
Hi, how are you? How it is?
Miss McGinty.
Hi, Miss McGinty. Go ahead and have a seat. How can I help you today?
I just wanted to have a little chat with you. I was just in the doctor's office with one of your doctors, and she just didn't listen to any of my concerns that I was having.
Really?
Yeah, I was explaining to her my back problems and my arthritis, and her only explanation was to give me painkillers.
Well, I'm sure that's not the case. She's a very good doctor, and she's been on staff with us here for many years. She's actually one of the best doctors that we have here on our staff. What were some of the things that you were having a problem with?
Well, I feel like she kind of just dismissed me because of my age, that my problems weren't getting better because I was elderly and I was forgetting to take my painkillers, which isn't the case. My body's going, but my mind's still here.
Oh. Well, you know what, Ms. McGinty, I'm so sorry that you had that issue. I will definitely speak with her in regards to the situation. And what we'll have you do is I'll just go ahead and walk you out and help you get your prescriptions. And hopefully we can, take care of the situation for you. And I'm sure you won't have that problem again. Okay?
Okay.
Alrighty then. Let me help you up, sweetie.
Thank you.
I'll get someone at the front desk.
As you can see, the physician was not listening to her patient. Because Mrs. McGinty is an elderly patient, her practitioner should have moved closer so she can hear her concerns and explanation of her condition. Additionally, being at a closer range communicates to the patient that the physician is paying attention and thus resulting in better trust from Mrs. McGinty. Dr. Najjar should have also examined other treatment options after discovering that the painkillers weren't effective. Furthermore, it seemed as if the doctor was in a hurry and jumped to the assumption that because the patient was elderly, that caused her to forget to take her medication. This error in judgment places blame on the patient for her ailments. The administrator did a good job of listening to the patient's complaints and asked questions to gain further understanding and can offer a solution to help the patient get the service and attention they deserve. The elderly population aren't the only ones who struggle with their practitioners and or the services they receive. In the next scene, we will observe cultural differences can be a hindrance in delivering health care.
مرحبا كيف حالك؟ let me call you back. I gotta go.
Hello, Ms. Najjar.
Hi,
how are you?
you?
I'm Dr. Rivera. So why don't you tell me what's troubling you today?
Actually, it's Dr. Gray. I was expecting Dr. Gray.
Well, why is that?
Well, I just feel more comfortable speaking to a female physician because of my religion. I just don't really feel comfortable talking to a male.
Well, she's actually out of town all week. I'm covering for her.
Oh, is there anyone else I can see today?
Unfortunately, she's the only female physician that we have here.
Oh, what should I do?
Well, we could see if we can schedule you for sometime next week when she's back in town.
Wow, I really needed to see her today. That's going to be an inconvenience, but I guess I have no choice.
All right, well, I'm sorry for your inconvenience, Ms. Najjar, but we'll get you up front and we'll get you situated, okay?
Okay, that's fine.
Good morning, my name is Dr. Reeves.
Hi, how are you?
What's your name?
Ms. Najjar?
Ms. Najjar, nice
Yes.
meeting you. Now what seems to be the problem?
I actually came in today to see Dr. Gray, but I wasn't informed that she was out of town, so it was a big inconvenience for me. I really wanted to see a female gynecologist today.
And why is that, may I ask?
Well, I'm Muslim and I just felt more comfortable speaking in front of a male gynecologist instead of a male, so it was a big inconvenience for me that I couldn't see her today.
Okay, that's understandable.
Yeah.
I do apologize for that. Well, Dr. Gray is out on vacation for the rest of this week, but we do have a Dr. Smith, and right now she does have an available time at 3:30 p.m.
Okay with you?
Well,
Yeah, that's fine, as soon as
with you?
possible.
Okay, and I do apologize for that.
That's fine. I appreciate you accompanying
Thank
me.
you.
When speaking with the administrator, we learned about her tradition and feelings toward having a male physician. Many cultures that stick to traditions will argue that they should have a female gynecologist, same with men who will prefer a male for urology or proctology. By accommodating patients by having more than one of each sex, scheduling would be much more efficient and we can get them in sooner rather than having them wait for an available male or female practitioner. In many environments, language barriers can cause misunderstanding and emotional distress. The next scene examines language difficulties and the inability to accommodate.
Hi, Mr. Rivera. I'm Dr. Kirkwood. How are you today?
Good.
Good. How can I help you today?
Es que me tropecé más temprano ahora, me tropecé y me pegué el brazo, pero me duele muy feo.
So it's your elbow?
Sí.
Okay. Did you bring anyone with you today for interpretation?
I'm sorry?
Did you bring anyone with you today to help interpret today's doctor's visit?
No.
No? Okay. I am not able to understand you. So I'm going to have to get someone to help me, okay? So if you can hang on for a moment, I'm going to see if I can get someone to help us, okay?
I'm sorry. ¿Qué?
I'm going to get someone to help us. Hang on a moment.
Excuse me.
Yeah, good morning. How are you? How can I help you?
Doctor, no me puede ayudar.
I don't speak Spanish.
No me puede ayudar. Mi brazo me duele muy feo.
We are short-staffed on this one. We don't have any translators on this building right here. But I will make my best and work diligently to make sure.
It's all the time.
that-
It's all the
Dr.
time.
Reeves, I've been looking
Yes,
for you.
what seems
I'm
to be
having
the
a problem with
problem?
an interpretation today. This young man is here to see me for his elbow, and I'm
Yes.
unable to get an interpretation. What are we going to do about this
There's
situation?
someone else here that can help us with this?
No, yo
Or
vine solo.
You came by yourself and there's no one else who can help you?
No.
Translate at all?
No.
Okay.
It's all the time. This always happens.
We are very sorry, okay, for the inconvenience. We do
The patient
apologize.
spoke mainly Spanish with a few English words thrown in, but the problem remained. The clinic did not have any employees with the ability to translate for him because neither the physician nor the administrator were able to assist Mr. Rivera. He grew more and more frustrated and eventually walked out. The sad truth is that without these communication services available to patients, especially in areas with higher populations or specific ethnic groups, these patients will avoid facilities that can't accommodate their communication concerns. One method for understanding how to better assist special populations is to reach out and get the community involved. By encouraging participation in a patient survey, we get a deeper comprehension of which services we lack, which services need improvement, and what we are doing well. Once we have that information, we can formulate a plan to improve the quality of the clinic. Other demographics that may require special services include, but are certainly not limited to, the disabled, children, and LGBT individuals. We strongly recommend attending a seminar about other populations to gain a better understanding on how to further aid them and communicate with them more effectively.